there's a lot of different stem cell technologies. Everybody's got kind of their own spin on it. What makes Denver Regenerative's stem cell procedures different?
For one, I'd say one of the primary differences between our clinic and a lot of the other clinics that are out there is our ability to offer a wide range of stem cell based services. So for example, if after doing an examination on you and speaking with you, we determine that the best option is going to be to use your own stem cells, we have the ability to extract your own stem cells from your body. Our board certified medical doctor will do that procedure. He's trained to do the extraction procedure, and we can isolate your own stem cells and use those. If we determine in the course of doing an examination and a consultation with you that we feel that using umbilical cord or donor stem cells is going to give you the best result, we have the ability to do that as well. Whereas many or most other stem cell clinics will only offer the donor cells because obviously it takes a lot of experience and training in order to do the extraction process.
So you don't take a one-size-fits-all approach like other clinics?
No, absolutely not. We evaluate the patient. There's a lot of factors that go into determining what the best course of treatment is going to be. Factors like your health status, for one. So just to give a good example, as a general rule, if a patient's over 65, we're tending more to recommend that they use umbilical cord donor stem cells because they're newer, they come from a fresh source. They're going to be most likely more effective than a patient who's over 65's stem cells are going to be. However, if that 65-year-old that we're examining is in fantastic physical condition, exercising regularly and taking care of themselves, it may be a situation where their own stem cells are still going to be viable and going to give the same or better result than donor umbilical cord stem cells would.
And are there financial or cost reasons why you might choose one over the other?
No, it's the same price for both procedures, roughly in the same price. So really, cost isn't much of a factor in deciding whether we're going to go one route or the other. It's all going to be based on what we feel is going to be the best, provide the best outcome for the patient.
Got it. And I saw that you also offer other services or other, mixed modalities. So can you tell me more about that? Like PRP, I know you offer that, and you have some other different combinations that you'll do as far as like stem cell and other modalities.
Sure. So with every orthopedic stem cell procedure that we do, if we're doing a joint, muscle, ligament, tendon, if we're repairing those type of orthopedic conditions, we're always combining our stem cells with PRP or platelet-rich plasma, which we obtain from the patient. So whether we're using donor umbilical cord cells or whether we're using your own cells, the first thing that happens when you come into our clinic for a procedure is we do a small blood draw. And we take that small amount of blood and we put it into a high-speed centrifuge and spin that down so that we can isolate just the platelet component of that blood sample. And that's what we'll add to either the umbilical cord cells or to your own stem cells. And it acts as like an activator or like fertilizer, if you will, to jumpstart the stem cells and allow the procedure to take effect more quickly. Another way that we administer stem cells is through an intravenous application. So patients will come to us for an intravenous systemic stem cell procedure if they're suffering from a wide range of autoimmune diseases, if they're suffering from some neurodegenerative diseases that we can treat, or if they just want to improve slow advancing aging and use it to improve their general overall health in an anti-aging environment. That's also another thing that we use stem cells for. In that type of situation where we're using an IV infusion of stem cells, we only use donor umbilical cord stem cells. And the reason why is because when we extract your own stem cells, there's still some components of your blood that allow for clotting, and obviously we wouldn't want clotting in an intravenous application. It's helpful when we're treating an orthopedic condition because those clotting factors actually aid in the healing and regenerative process in a joint or in a ligament or in a tendon, but obviously in your blood vessels.
Only when it's a targeted therapy.
Right.
Got it.
We want to be as safe as possible. We don't want to run the risk of having an embolus in an infusion, and we eliminate that by using donor-sourced stem cells.
Got it.